doing your head, ears, eyes, nose, and throat exam today. Nice to meet you.
Nice to meet you.
Okay. First, I'm going to inspect and palpate your head. Okay. Just look at your hair and your scalp. Okay, looks great. Okay, that's good. Next, we're going to move on to the eyes. We're going to start with the visual acuity. So I'm going to stand 6 feet from you, and then you're going to cover one eye, and we're going to do see how good your vision is. Okay. Okay. So please cover one eye, if you don't mind. Okay. So if you can, just read the lowest line possible that you can see.
LTFPH.
Awesome. Okay. And then you can take that one off, and then cover the other eye, and then you're gonna read the lowest line that you possibly can.
LTFPH.
Okay, awesome. So 2020. You have contacts on, but still 2020 with the contacts. That's still good. Okay. So now we're gonna check another vision test. I'm gonna have you cover one eye also. I'm also gonna cover one eye, and you're gonna tell me how many fingers I'm holding up at each time. Okay. So yeah, you can cover one eye, and this is just gonna test all 4 quadrants. So just tell me how many fingers, 1 to 4, that I'm holding up. Okay.
1, 2, 2, 1.
Awesome. Okay, that's good. Now you can cover the other one. We're gonna do the same thing on that eye. Okay. Ready? It's gonna be fingers 1 through 4. You can tell me how much I'm holding up.
1, 2, 1, 2.
Awesome. Okay. That's very good. You did really good so far.
Thank you.
So now I'm just gonna inspect your eyes. I'm just gonna look at them. I'm gonna shine a light in, so just don't be alarmed. Just gonna look at them. Okay. They look really good. They're equal on both sides, symmetrical. Okay. So now I'm just gonna test some extraocular eye movements. So just if you can, without moving your head at all, just moving your eyes, can you just follow my finger? Okay, that's good. And now I'm gonna check for nystagmus. So like I said before, just keep your head straight and just follow my finger. Okay. Okay. No like eye jerking motions. That's good. Yeah, that's great. Good job. Okay. So now I'm just gonna look at your eyes. No lesions, nothing. They look good. Okay. So now I'm gonna check for corneal light reflection. So again, I'm just gonna flash a light in your eyes. So just look straight ahead. Okay. Yep, perfect. Okay, good corneal light reflection. So now we're gonna do something called a cover-uncover test. So we're gonna hold something over one of your eyes, and you're gonna focus on an object. So I'm just gonna give you something to cover your eye. Okay, so you can cover one eye. Okay. Yeah, so you can cover one eye. I'm just gonna have you look at that picture over there if you can, and I'm just gonna look in your eye. Okay, now I'm just gonna move it away. Keep on looking at that object. Keep on looking at it. Okay, that's good. Okay. Keep on looking at the picture, okay? Okay. Okay, that's good. So that was the cover-uncover test. Your eye didn't move at all, so that's a normal finding. Okay, so now I'm just gonna inspect your eyes. So I just wash my hands, don't worry. I can look at your eyes. Okay. Pink, that's good. Just there you are. Okay, good. And your eyebrows look good, equal. Alright. And no foreign bodies. And was there any pain when I was touching your eyes? No. Okay, that's good. Alright. So now I'm gonna check for the ocular fundus. So let me just attach this really quick. Turn this on. Okay, great. Okay. Okay, so now I'm going to look into your right eye with so, okay, perfect. So I'm just going to look at your right eye. Okay. Alright, that one looks good. Just look at the other one. Okay, that looks great. Okay, that's good. So ocular fundus looks good. Everything looks normal in there. Okay. Now we're gonna move on to the ears because everything in the eye exam looks good. Okay. Me too. Okay. So we're gonna go to the ears, yeah. So I'm just gonna look inside your ears. I'm gonna insert this otoscope. Just let me know if there's any pain. Okay?
Will do.
Okay, great. So I'm just gonna look first. Okay. 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 That looks pretty good. Okay. Pulling the ear up and back so I get a good picture. Okay. That one's good. I'm just, no, you can say I'll just come to the other side. That's good. Nothing in there that's concerning for ear infection. It's no pink, no edema, no protrusion of the tympanic membrane, nothing like that. So that's good. Now I'm just gonna palpate your ears. Like I said, let me know if there's any pain or tenderness. Okay, just pressing down on the tragus. Any pain or tenderness?
No.
Okay, good.
Good thing I have no ear piercings up there.
Good thing. Okay. So any pain or tenderness? No, I'm just gonna press down on the tragus. Nothing? Okay.
Good to go.
Okay. Everything looks good there. So another thing with the ears, we just have to do a whisper test. So this is going to check for your hearing. Okay.
Oh.
Okay. So I'm just going to whisper a word in one of your ears and just repeat it. Okay. All right. I'm just going to occlude this one ear though. Okay.
Mm-hmm.
What was it?
Pencil.
Okay. Good. Okay. So we're going to see on the other side. Okay. And see there. I'm going to whisper. Okay, good job. That's really good. Okay. So even though that was normal, I'm still gonna do a little bit more hearing exam just to make sure that everything's okay. Okay. So first, we're gonna do the Rhine test. So I'm gonna put this up to your ear, and you're gonna tell me when you stop hearing the noise. Okay. And then I'm gonna move it, and you're gonna tell me when you stop hearing the noise again. Okay. Ready? Okay, hold on 1 second. Sorry.
Oh.
Okay, so that's good on that side. That means that the air conduction is greater than bone conduction, which is normal, so that's good.
Oh, good. I don't know if I've ever done that to me before.
So now we're going to do it on the other side. See?
Okay. Stop. Stop.
Okay, same thing, like I said. Air conduction is greater than bone conduction, so that's really good. Normal as well. Okay, one more thing is going to be the Weber test. I'm going to put this on top of your head, and you just tell me if it's equal or unequal on both sides. Okay?
Got it.
Ready?
Yes. Yes, it's equal.
That's good. Also normal. If it wasn't equal, that would mean there's lateralization on one side, which is not good. But everything's normal for you on that one. So that's good. Now, we did eyes and ears. We're going to move on to the nose exam. So first, I'm just going to look at your nose. No lesions, nothing like that. No bleeding, so that's good. We're just going to check for patency of your nose. So if you can, just occlude one side of your nose and breathe in, okay? Okay, great. And now the other side, yeah. Okay, perfect. So you have patency on both sides of your nose. So that's good. Okay, now I just have to look inside of your nose, okay? So I'm just gonna insert this otoscope into your nose. So I'm just gonna have you tilt your head a little bit back. Okay, that's good. I'm just gonna look inside your nose. Okay. Okay. Other side. Okay. Okay. No redness, no edema. It's pretty normal to me.
In here.
Maybe a little bit. That's okay. That's normal. Okay. Now we're gonna go on to the sinuses. So here, let me put the lights in here, but we'll just try our best. Okay. So this would be just checking for like a sinus infection. So I'm just gonna look. Okay. This side. So that's just your frontal sinuses. Now I'm gonna look in your maxillary sinus. It's a little hard to do this when it's so bright in here, but that's okay. I don't see any signs of sinus infection, but we're also going to do a little further testing for that as well. I'm just going to do one more time. I'm just going to have you, if you can, just open your mouth. Okay. 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 That looks good. Okay, so now I'm just gonna palpate your sinuses. So just let me know if you feel any pain or tenderness. Okay? Anything?
Oh, that feels great.
Okay, so no pain or tenderness there. Okay, that's a good thing. Now we're just gonna percuss your sinuses. So that's just like it's just like a light tapping. So it shouldn't hurt unless you have a sinus infection, which so far I don't think you do. Okay. Anything? No pain? Okay. Great. That's good. That's good. Okay. So now, like your nose exam looks pretty good. We're gonna move on to the mouth and throat. Okay. So first, I'm just gonna look at your lips. No lesions. Nothing going on. Okay. So now I'm just gonna have you please open your mouth if you can. Yeah. So yeah, just open it.
Say ah.
Not right now. Just open. Thank you. All the palates are good. The gums are good. Pink and moist. Oh, okay. Now I'm just gonna be lift up your tongue. Just look underneath. Okay. Thank you. Okay. Okay. That looks good.
That's what the dentist does.
Yeah, that's good. You go to the dentist. Okay. Now I'm just gonna have you stick out your tongue and say, I'm just gonna make sure everything's midline. Okay. Uvula is midline, so that's great. Okay. So now I'm just gonna check for some cranial nerves. So first I'm just gonna have you just take a sip of water if you don't mind.
Thank you for preparing for that.
Of course. Okay, perfect. That's awesome. Okay. Now I'm just gonna have you cough, just do a little cough if you can. Okay, that's good. That's good.
Oh,
that's good.
Following instructions.
Okay. Yeah. Also, if I were to find anything abnormal, I would check a gag reflex, but we're not going to do that because you're conscious and that would be really uncomfortable. But that would be also another way to check for cranial nerves. Now I'm just going to have you, if you can, just stick out your tongue and move it side to side, okay? Okay, great. You can do that. So cranial nerve 12 is great. That's perfect. Okay. So now we're gonna move on to the neck exam. Just gonna look at your neck. What kind of masses?
You checking like thyroid stuff?
That's gonna be in a minute, yeah. But right now I'm just like inspecting. Okay, that's good. Now we're just gonna do some range of motion. So if you can, you could just follow what I do. So just tilt your neck up and then down. Okay, that's good. Side to side. One, and then the other side. Okay, great. That's good. All right. That all looks good so far. Trachea is midline, so that's also good. Now we're just going to auscultate some things. So I'm just going to use my stethoscope. I'm just listening for a couple things. Okay. Okay. You could just, you're good where you're at. If you can, just turn your head to one side. Okay. That's good. Now the other side. Carotid sound great. No throaties heard at all, so that's good. Now I'm just gonna palpate your carotid pulse. So I'm just feeling to make sure you have a pulse in your neck. That's good. Okay, that's really good. Your pulse is good.
Exactly.
Yeah, that would be a big problem if that was not. Okay. So now I'm just gonna check for your thyroid. So I'm gonna be palpating your neck. I'm gonna go around and put both hands on your neck, but don't be alarmed. Okay. Okay. Great. Any pain or tenderness?
No, you're very gentle.
That's good. Okay. Pain or tenderness?
No.
Okay. Now I'm just gonna feel your thyroid.
Mm-hmm.
Okay. Okay, so that's good. You have no masses. I'm just gonna also have you take another sip of water. I'm just gonna make sure you have no nodules in your thyroid. So when you're ready, perfect. I don't feel any nodules, so that's great. The last part of the exam, I just have to check for lymph nodes, just to make sure there's no swollen lymph nodes. So there's a few. I just have to palpate a few areas. Okay, so just feel free. Okay, thank you. Okay. So just as I'm doing this, just stop me if you have any pain or tenderness. Okay. 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 Any pain?
Mm-hmm.
Nothing. Okay. Nothing. Okay, great. Sorry, I should have moved your shirt to the side a little bit. Nothing. Okay. Nothing, right?
Mm-mm.
Okay. Sorry, I just have to lift up your arm a little bit. Okay. Just a few more lymph nodes underneath here. Okay. No pain?
Mm-mm.
Okay, we're gonna do the other side then. Okay. Yeah.
Mm-mm.
Okay, awesome. Okay, everything in your exam looks really good. Definitely good to hear that everything, head, ears, eyes, nose, throat.
I think you were very thorough and very gentle, and I appreciate the exam.
Okay, no problem. Okay, thanks.